All right. Well, good morning, everyone, and thank you for joining us today for our first session in the NGO Industry Day. Today, we are very happy to have joining us Lekilay Tehmeh, who is an alum from the school. He's going to talk to us about the journey that he's been on in terms of work, how he's used the training to do work, and then just answer some of the questions that are here. I will encourage you, if you have questions, to please put them into the chat. We'll definitely have time for Q&A at the end, but I will have some guided questions to get us started. But what I'd like to start off with is first having our speaker give a quick introduction about himself.
Thank you so much, Paul. And it's an opportunity to talk with you all. My name is Lekilay Tehmeh. I'm a public health physician, a Liberian by nationality. I actually graduated from the first core of the Patient Safety and Healthcare Quality Program. If you were familiar with the online program for applied learning at Hopkins. Basically, I started up as a medical and research coordinator at the Liberian Medical and Dental Council, working on regulation with a very big desire to set up Liberia's first accreditation program, while also working as a clinician at an emergency obstetric and gynecological hospital in Monrovia. So at LMDC, I actually, applied and basically for this program at Hopkins, and I got actually transitioned from clinical care because of this program, and actually started doing quality of care work assigned at the quality management unit of the Ministry of Health, while I was also doing my master's program at Hopkins. So currently I work with the Last Mile Health, community health organization with a mission to bridge the gap in access to care around the world. So at Last Mile Health, I work with the programs and systems teams to ensure integration of clinical best practices and evidence in order to inform policy and program strategy as we strive to achieve excellence in service delivery at the community level, with concentrations in malaria, pneumonia, diarrhea, malnutrition, as well as quality of care in these areas.
Could you say again, where are you currently working again?
Last Mile Health.
Do you mind putting the URL or the website for it into the chat? If anybody wants to take a look at it while we're talking, I think that would be great. Okay, well, I think, students are always very kind of interested in terms of what the work looks like. And so be curious to see, what you kind of say. Can you share what you like the most about working within an NGO? And then also what do you find either you like the least, or maybe you find the most challenging in working within the NGO?
Yeah, thanks, Paul. So what I like the most is in the NGO sector, there's a huge opportunity for you to grow. Capacity building opportunities are usually provided for most NGOs. They provide for their staff. And there is this trend of continuous growth, and you have the ability to network as much as possible within the particular subject matter area that your NGO is concentrated. And this obviously expands your scope, and you're able to definitely make an impact in the sector as much as possible. So what I like the least about the NGO sector is most of the NGOs or the organizations, global international NGOs, they are mission and priority specific. So if you have an individual interest, sometimes you're not able to circumvent that interest of yours. You have to find a way to stick to that organization's mission and the priorities that have been established.
And have you found that that kind of challenge in terms of following the mission of it sometimes runs counter to what you might think is the right thing to do?
Well, sometimes, yeah, I mean, you can have, you can, I mean, not in a negative sense, 100%, but sometimes, for example, I have a background in patient safety, obviously, very much interested in patient safety. My organization's mission is not directly in patient safety, even though it's somehow involved. Uh, um, my mission, the organization's mission is to work with remote, isolated communities to provide healthcare services for those communities. I also have an experience in like healthcare facility work. And sometimes, because of that overall organization-wide mission, you are restricted a little bit on what you can do to make the most impact for that group of people that your organization seeks to impact the most.
Got it. Got it. So I think what you kind of say there, but also to kind of lead into the next question is, what are the skills or knowledge that you gained while you were at Bloomberg that are most useful in either the work that you're doing or the career that you're in right now?
So I'll start first of all because I have a background in quality and safety from my training at Bloomberg. Uh, that background in itself, designing quality improvement systems, programs, understanding the entire sector and things related to performance measures and how you can make informed decisions, when it comes to really understanding the challenges in a particular health system and how to help that system improve. Um, those were all things that, coupled with most of those very core public health courses that I had the opportunity to take, epidemiology, understanding like diseases and how they are distributed within the population, the impact of these different things, biostatistics, all of these courses, these areas, these concepts gotten from these courses really helped me. Professional writing, don't take it for granted. I think that also contributed a whole lot in communication skills, some of those things.
And would you say the writing that I assume that the writing wasn't like a writing class, or maybe there was a writing class that you took, but how did you feel like you kind of learned the professional writing skills that seem to be really important for any organization you might work with?
So I did have a specific course on writing for my program. That was advanced writing. Basically focused on things like uh, briefs, writing briefs, op-eds, those kind of different things. And then that whole overall institutional focus on writing professional papers and getting like feedback, getting like the guided support in ensuring that your paper is up to that standard of the university. I think that played a very major role in like, building up my skills in writing and making sure that I was using evidence-based information. I was maybe researching very well. I was, using all of the different things that were needed to, actually communicate within a professional environment.
So it's almost like the school, the environment of being within Bloomberg is a great kind of incubator for kind of mimicking what it would look like to do professional writing in the workplace.
Exactly.
That's great. Perfect. Perfect. So now I want to transition a little bit to the kind of talking about kind of what the steps are taking for doing the job search. So we know that students will be graduating next month, or are looking at various kind of job opportunities and things like that. And I'm just curious to say, what were the All right, I'm muted. Let me start over with this. So now I want to transition to the whole job search type of things as well. And just to kind of mention that many of our students will be graduating soon and that many of our students might be looking for jobs, and curious to kind of find out from you, what were your post-graduation job search strategies? What is it that worked? What is it that did not work for you? Can you test your mic? Caroline, can you hear anything? Not yet.
Can you hear me now?
Yes, now okay.
Okay. Sorry about that.
But
So, so one thing you want to do is to have a very broad mindset. Even though you have like an area of concentration, you have expertise in certain areas. Uh, you did probably epidemiology, or you did biostatistics, or maybe you did international health or something. You want to make sure that you, even though you have like a focus, a goal, a professional goal for yourself, but you want to expand your scope as much as possible to see what opportunities are there, both in your area of concentration and like the general public health sphere. You sometimes might not have the opportunity to begin at areas where you have the most strength, but you want to at least cultivate that habit of really seeking opportunities and using uh, the available opportunities to really serve like as a stepping stone for your growth process, or for like launching onto another organization also. So in my case, what actually worked was that I was in clinical care, also working in regulation, and I started this job, and there was a unit at the Ministry of Health, post Ebola. We have found out that our health system got really hit the hardest as a result of the issues with quality, issue with safety, and those kind of different things. And when I got this opportunity, reached out to leaders at the ministry, and then pitched this out to them and say I could be a help while doing my program, because this was directly related to things that were being done at the unit level, and I could bring in high level context, high level experience from the learning, even though I wasn't an expert by then. But I got accepted at the ministry to support, and then I found out that there was a lot, missing. So I used the opportunity of working along with international NGOs that were interested in the scope of work of that unit. WHO, US CDC, JPICO, all of the organizations that had like expertise and had like different experts working, especially strengthening things like infection prevention and control, quality assurance processes at the healthcare facility level, those kind of things. So I didn't find a lot of jobs, in like my specific concentration, healthcare quality and safety, except for like US based jobs, with different hospitals where the issue of patient safety and healthcare quality was well, grounded, and these were areas where they had like, but at least I had the opportunity of blending with the current system in my country, Liberia, and use it as a baseline for myself, to kind of start up.
And I like a lot of what you said there. So just a quick kind of add-on question. The work that you were doing for the Ministry of Health, was that a paid position? Were you a contract worker? Was it just unpaid while you were still a student? How did it first start?
So so I was already a staff of the Ministry of Health,
Okay.
a government employed. So it's just a matter of transitioning me
Okay.
so that role, where the ministry agreed that I was going to be a lot more effective as well.
Okay. And also too, like what you said too about the idea of offering your almost kind of volunteering your services or suggesting to your supervisors and staff at the Ministry of Health. But this can be applied, I think, anywhere, is where you almost have to advocate for yourself to say, I can bring this into work or working on this. I've been learning these things and things like that. Did you find that difficult to do, to kind of convince somebody that you could kind of address these problems or work on these projects, when you were speaking with them?
That's a good question, Paul. So initially, I mentioned that I used to work part-time with the Liberia Medical and Dental Council. So part of my job was to supervise clinical inspectors. These inspectors would visit healthcare facilities, and given the minimum standards we had, they will work with those healthcare facilities, identify gaps in their operations, and recommend strategies or different things they need to do to improve. And we, in fact, provided some level of accreditation, which was not a more comprehensive one, but based on just very minimum standards and assessments. So I was already in the sector. I availed myself to partake in a lot of these different engagements with the Ministry of Health and stakeholders working within that scope. So I was a bit, for my case, I was a bit familiar with the system. People knew what I was doing. I contributed to conducting a nationwide survey in infection prevention and control across Liberia during Ebola to inform stakeholders and partners supporting the response to focus more on improving infection prevention and control practices at healthcare facilities. So it wasn't too difficult for me. In fact, my scholarship had been provided by the Ministry of Health. So it was a matter of just reminding them that you have this person you're training, and the knowledge. There's a lot of gap in the sector. You needed to tap on it, and I think they bought into that.
So it was just reminding them of the investment that they were making in you,
Right.
and then getting the return on that kind of investment.
Right.
So yeah,
Right.
that's great. So I do think it actually kind of leads kind of very, well into the next kind of question about, the importance of building a professional network. So I think you kind of touched on that a little bit. And then, you also to mention how you were able to leverage that into a position. But I guess maybe another kind of component of doing the networking as a job search is kind of thinking back to how do you maintain those relationships? So what is it that needs to be done in terms of, you know, uh, doing the connecting or doing the updates? Is there something that you found that's good that you use to maintain those professional relationships?
Yes. Thank you, Paul. Firstly, uh, what I try to do is set myself in a position where I can effectively work with all partners, all organizations, in my line of work. Build relationships and those kind of things. Establish myself as an authority, a local expert in patient safety and healthcare quality in my country. The apart from maybe certificate trainings and those minor trainings, I was the only one uh, on a path of really acquiring a degree in patient safety and healthcare quality. So I had to like regularly touch base with this subject matter and make sure that I'm actually promoting the entire concept. Whatever meeting I was in, discussing things related, I was making sure that my voice was being heard, continually promoting the agenda of healthcare quality and patient safety. And then I also, didn't neglect the fact that there was an international body out there, or there are international bodies out there that are in this line of work, following them and making sure that I'm attending webinars, I'm part of different activities. So basically just keeping my external network, being part of International Society of Quality, being part of paying member of like the of ICANN, and other related organizations, IHI, and then really continually networking with colleagues at the WHO who came in country to do one or two work, CDC colleagues. So these are all things that I try to really do. And then actually, yes, I did leverage on this to basically get to where I am currently. Uh, so so basically, yeah.
Would you say too? I always kind of feel like it's like I think that students almost kind of feel like they need permission to leverage these relationships. Do you feel like that it's it's perfectly fine to to develop a connection with somebody and then leverage that for future conversations?
So not necessarily individuals. I mean, it could be individuals, but at least these organizations knew that in this line of work, I was, a major contributor. And I'm guessing most of them knew what I was capable of, contributing to their individual or respective organizations. If they had a role that suited me, definitely I'll be a good candidate for that role.
Perfect. So we did have a question from our audience. So Lucas, if you want to go ahead and unmute yourself and ask the question.
Sure. Yeah, thank you very much for all these very interesting insights. There are two things I wanted to touch on particularly. So, or two questions, I'll just ask them at once. And so the first one is, you said you started in patient care actually for a few years. And I was just wondering, if this is something where you feel that you still profit from even in your public health work today, if you would advise to continue clinical training for some time. This would be your first question. And then the second one, you also said that you started in a governmental position, and from what I've seen now from this last mile health, now this is not a government position anymore, right? So I was just wondering, like in my home country, at least, government jobs are usually something that is very, very safe. And it's something that often holds people back to move into NGOs because the job is not safe. They might have a family to provide for. So I was just wondering, how was that for you when you went out of government?
Yes, thank you, Lucas. Very excellent questions. To start, clinical training is very vital to public health in general. We encourage anyone, even if you're still in clinical practice, if you have an opportunity to continue clinical practice and follow through your public health career, I would advise that as much as possible. Where I'm from, the situation about government jobs versus NGO jobs is opposite to your experience. Government jobs, they are low paying. Obviously, I come from a third world country. They are mostly there are issues with resources, to the extent that, sometimes you have a project, you have a program, and you don't have like a budget line, from the government to support that. Largely, things are supported by international NGOs and partners in Liberia. So in Liberia, apart from like the very high level government positions where there are a lot of amenities, the NGO sector seems to be a more attractive area. I don't know what I've addressed your question.
Yes, thank you very much.
Okay. Again, if anybody has other questions, please, you can either drop them into the chat and I can read them out, or you can raise your hand and come off mute and ask a question as well. But I do have another kind of question is, so I think we've talked about the skills and things like that. So I would also like you to think about even just the broader kind of doing any type of work internationally. What do you think are some of the more either important skills to have, but maybe, or even the knowledge to have, or just an understanding of kind of what that work would look like? And are there things that really kind of stand out to you, maybe that you've already touched on, or new things you can kind of think about?
Sure. So I'll start off firstly by saying your people skills has to be top notch. You need to be able to adapt, and you should look for creative ways of adding value to the organization, whatever organization. Your writing, your technical writing and professional writing skills obviously has to be good to thrive in these areas. Your ability to analyze and interpret information, especially data, is very key. You should also value difference and diversity as much as possible, because international jobs are not just limited to a unique group of people with similar ideologies or diversity, different mindsets, different backgrounds, and those kind of different things. So you also need to understand and stick as much as possible to the organization's core missions. because sometimes that's how, for example, if you have like a specific grant that is saying, okay, you have to make sure that malnourished kids are taken care of, you refer them for treatment, and then make sure you follow up, ensure that they improve while you are regularly visiting them. This is something you should stick to it as much as possible, and base your measures, your key performance indicators around it as much as possible.
You mentioned quickly there about grants, and I'm just wondering about this too with kind of any international health work, the knowing that so much of it is funded, by donors and stuff like that. Have you had to kind of learn how to manage money or do budgets? Is that a part of the work that you find that you're doing as well?
Yeah, sure. You're given the opportunity to manage, like for example, I manage two grants. Currently, I didn't manage a grant before joining the organization, so those are is one of the things I learned. And then you have a budget, obviously. You have to manage. I didn't have a very strong financial management skill. In fact, I didn't even have a budget to operate with at the ministry. I currently have been able to adapt some of those skills, project management, those kind of things. So I manage both projects and grants. I manage a project known as quality of care, and basically related to all of what I do.
And would you say that it's you can rely on other people that know some things more, or you just had to kind of teach yourself some of these things, or it's a combination of the two?
So one thing I've learned from working with my organization is there's a lot of cross-team collaboration here. A lot of folks sitting in a lot of different units, especially for my role. I sit in a department, but my work is not just limited to that department. I have to contribute to the systems team, programs team, into digital health, just in case you're designing a tool for clinical care and those kind of different things. I have to work along immunization, those kind of different things. So there's a lot of cross-team collaboration where I work.
Got it. All right, so I have two more questions, and it's not one here, but I want to ask it before I get to the last one. So I guess and it kind of ties in a little bit to the last thing in that the different type of cross collaboration work that you could do, the different doing things like in digital health or systems and things like that. But I guess I'm curious, is there an area that you believe has the most, like for you, professional growth opportunity? So if there was an area that you'd want to go into or something you might want to do, where do you think you could see yourself kind of going into your kind of next thing?
Well, growth wise, I still hold on to my, my fundamental training in quality and patient safety, obviously. I've done a lot of continuous, I've touched base continuously with this sector, even with some of my professors. I mean, I was really excited to be at some international meetings with some of my professors, and even though it was a great reunion, but I felt that it was an opportunity to continue to serve in these different areas. And like I said initially, this is where I always want to be, supporting quality, improving quality systems. improving systems, ensuring that I'm making the most impact wherever I work. But I would definitely keep my 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 I'll keep my eyes open, just just in case, I'm not narrowing things down too much, to the extent that, if I have another opportunity, I can use as an opportunity to really interject some of the skills that I've acquired over the years. I can definitely, move on.
Yeah, and I think that's an important thing to kind of say is like it kind of sounds like there's there are certain things that are really important to you, like things that you really kind of value in terms of the work that you're doing, and that's kind of a unifying theme of the various steps that you've taken in your career, and probably you'll continue to do that as well. So I think it's good for students to kind of hear that as well, to kind of know it's like, think about what's important to you, think about what is really is a something that you value, and if it can be reflected in the work that you do, it might be something that you kind of carry on through all the stages of your career. All right, so I have one final question that I prepared, but again, if anybody has questions, they can ask them after this one. So just what is your kind of overall advice for students that are interested in wanting to work within NGOs and in that industry?
So, number one, I think you have to plan as much as possible. Map out your interest areas, and align yourself with a list of missions or goals. If you do that, I think you'll find out that you fit in a lot of different areas. Even though you did biostatistics or epidemiology, you'll find out that you align in different areas, because you discuss general public health, concepts throughout your training, despite the fact that you did something unique. Sometimes, the start of your career is not always, rosy. All right. You can even start in a volunteer position once you know that you will definitely profit off that position. You use that opportunity to network. Always don't think that you're going to get like a very big job immediately as you graduate. Look for areas where you can use as stepping stones. The Ministry of Health was mine, obviously. So those are two things I like to send forth as advice.
Yeah, I think that's great advice. I would definitely second both of those things that you said in terms of especially the stepping stone job, and it's not, you almost have to, I kind of call it, you have to build traction in public health or working within an NGO, but it's like you have to be able to demonstrate that you can do that. So, looking at volunteer opportunities as a way to gain experience is a great idea. So, just kind of paying attention to those things and how you can do them and how you can demonstrate that you have that. So I wholeheartedly agree with that advice as well. So that's the last of my prepared questions. Again, okay, go ahead, Rosemary. You go ahead and unmute and ask a question. That's great.
Hi, good morning.
Morning, Rosemary.
Morning.
Sorry,
Yes.
I can't be on video. I just had surgery. No, I don't have a question, but I just want to say something to Mr. Tehmeh, that I want everybody to know, students. I think I reached out to you way before I became a student. We are one of the alumni listed there. When I was so scared about starting my course, patient safety and healthcare quality. You are one of the, I reached out to two of the alumni, and you were one of them. You responded to me. You really inspire and motivate and empower people, because honestly, when you responded to my email saying, don't worry about this, just focus on this and this, and then you're gonna get a lot of help. I mean, now sitting here listening to you, I have a couple of weeks to graduate. I feel very honored. And I thank you for all that you do to empower others.
Thank you so much, Rosemary. It was really an honor also getting in touch with you. A number of students get in touch with me. Dr. Austin, Matt Austin, I mean, tries his very good best to, link me up with students who need and it was a pleasure and honor doing it as well. And I hope we'll stay in touch, definitely.
Thank you.
Thank you, Rosemary. I appreciate you saying that. Lucas, you have another question? Go ahead.
Yeah, thanks so much. Yeah, and again, thanks a lot for all the insights. So I was just wondering how close a connection you kept to kind of like this whole university research body throughout your work. So is that something where you feel I mean, obviously you give the talk here right now, but also in your day-to-day practical work, do you work a lot with like research agencies, or is your profession pure implementation? Do you feel, yeah, we've spoken about like these skills, how to write in a professional setting. I think this is something that's very much fostered through doing research as well. What are your thoughts on that?
Yes, I try as much as possible to stay in touch. In fact, my role at the Ministry of at the University of Liberia School of Public Health, even though I'm still struggling with time to really get involved in like most of the core research activities that are going on there. But I try as much as possible. I used to be a lot more in tune with, different research activities. As still in my organization currently, we're doing a number of studies that I serve as a principal investigator for research institutions. I used to work a lot with US CDC on the acute febrile illness surveillance project they run for Liberia. So I had to leave that because I was transitioning out of the ministry structure, so I could no longer maintain that. Definitely try as much as possible. I think that's something I need to continue to do a lot more work on. But teaching is also providing the opportunity to continually stay engaged with the research. Most of what I do as well are innovations. We pilot innovations within my organization to inform policy and strategy decisions within the community health program for Liberia Ministry of Health. So those are some of the things that we do in terms of staying connected with research and sharing of evidence-based information.
Yeah, perfect. Thanks so much.
Okay. Are there any other questions from anybody in the audience? If somebody wants to raise their hand, if they have a question, or put it into the chat and I can read that. Okay. Well, if there are no other questions, I just want to say thank you so much for joining us today. And I would encourage you to, everybody here, to come to our other sessions that we have planned for today with NEHA, a nonprofit organization, another alum who's going to talk, and then we have a session with PATH later in the afternoon. Let me see. No question. Okay. And then just as a kind of a follow-up, if anybody does have things they want to follow up with, feel free to reach out to the Career Services office or reach out to either Olivia or Caroline or one of us if you have a question about the NGO industry as well. We're more than happy to answer those questions for you as well. So thank you all, and look forward to seeing everybody at our later sessions today.
Thank you.
Thanks, everyone. Thanks, everyone. Nice engagement.